An investment in knowledge pays the best interest. Benjamin Franklin. Good afternoon, everyone. Today, I welcome you to the seventh webinar in the series conducted by the Alumni Association of Government College of Physiotherapy. Today's speaker, Mrs. Nigamaja Hariharan, is a clinical physiotherapist, certified childbirth and lactation educator. She has 23 years of experience working in areas of pediatrics and women's health. Her pediatric work is centered mostly around young children with developmental delay. She uses ICF model of practice and believes in minimum therapy and maximum functional gains for her patients. She believes that therapy should be stimulating and nurturing for the young patients and empowering for their parents. She is passionate about her work and keeps updating her knowledge in the field. Over to you, ma'am, for the session.
Can you see the screen?
Yeah, yes, ma'am. Very much.
Thank you so much. It's really a pleasure and it's a privilege for me to address all my teachers, with everyone in the gathering, my teachers, my friends, colleagues. So thank you so much for the introduction and thank you, Amal Mohan, for asking me to talk on this topic specifically. This is something very close to my heart. So let me just begin with the presentation. Is it seen on full screen?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay. So let us just begin. So the topic is about appropriate paper-based technology. So this is not a very new topic. This has been there since the 1970s. This is not a therapeutic topic as well because there are no specific therapeutic techniques we are going to discuss. This is an adjunct to a therapy. If you are a pediatric therapist, you will be very familiar with the list of equipments you will be requiring in practice for your children. In the therapy room, we require maybe bolsters, a balance board, therapy benches, walking frames, and at home the child may require a CP chair, and now, of course, for them to carry over some part of therapy at home for sitting, transfers, and all benches, a lot of adaptive equipments are required. And none of them come for cheap. If you make them in wood, they are going to cost in thousands. And with the growing needs of the child, what the child needs at 2 years is very different from what a child will require at 4 years, not just with the size of the equipment, but even the equipment which is required may be different. So, there are a lot of turnover. You have to buy and then you don't want to use them, you have to change it. So, it can be too much burden on the family of a child with cerebral palsy or any other kind of developmental anomalies. So it is a very handy tool if as therapists we can be familiar with this technique because this is very low cost, and with this we can build articles which are strong and durable, which we may want to use in our therapy practice, or we may want to teach our parents so that they can build articles for their own children. So, that way the cost which is incurred in the family can be, to a great extent, it can be reduced. So that is the idea of doing it. And I owe this technique, or where I learned this is, in my first job when I came to Mumbai in 1997. So I owe it to my mentor, Dr. Dhruv Mehta. He was the center head of the physiotherapy unit. A fabulous person, a down-to-earth physiotherapist. So he has always been the mentor to me, and we always look up to him. So this is the Children Orthopedic Hospital, the cerebral palsy unit. So I'm really proud to say that this is the first cerebral palsy unit which was started in the whole of Asia. This was sometime in the 1960s. This is in Haji Ali, Mumbai. Now this is SRCC Children's Hospital managed by Narayana Health. Now it is a full-fledged children's hospital, but back then it was just the polio unit and the cerebral palsy unit. So our OPD used to be a little slack on Wednesdays. So in one of those slack Wednesdays, when we therapists, young therapists were just lazy, sitting, doing nothing, having nothing to do. So our teacher, he showed us a small slideshow. I don't know if the younger generation may not be aware of a slideshow other than the PPT. At that time, it used to be the small ones. So you have to press and then just cast on the screen. So he had been to UK. He had been to London on a scholarship. He was spending a year there. So he was visiting the Bobart Center. He was trying to learn as much as possible about pediatric therapy and adjuncts. So whatever he could collect, he would bring here. So this was, introduced to us by him. So he showed us the slide on how low-cost equipment could be made with just card and paper. And there were a few handouts as well, which he had preserved and he brought it to Mumbai so that he can spread it across. So we started making from there. So first we made one or two small stools, and then we made one chair which didn't come out well. So it was like crooked chair. So that is how we began. So then I left Children Orthopedic Hospital, and the other therapists there continued. So I also picked up interest in this, and I started doing it a little bit more. I wouldn't say that I'm an expert because I'm also still learning. The technique also keeps evolving. So I am in a little way I'm trying to whatever I have learned, whatever I could experiment with, then I'm able to teach to others as well. So you must be wondering what is this APT. So APT or APBT is appropriate paper-based technology. For short APT, it is nothing but appropriate paper-based technology. Why this name? Because it is appropriate, because whatever articles are made are useful and they involve very minimal production cost, and they have to be environment friendly, and it is done exclusively from recyclable materials. It is paper based because 100% there is no plastic or anything else in this. It is 100% made of card and paper. Right? It is technology, definitely. It is not a high end technology, it is a low end technology, but it requires an engineering body of knowledge, is what is used to construct a variety of toys. It can be furniture, toys, so many learning material could be prepared. But today we are going to talk only about furniture therapy equipments, the one which we will require as therapists. So, little bit about the history. So, we cannot thank this man, Bevel Packard, any less, because it is because of this great person that we have this beautiful technique in hands. Mr. Bevel Packard, he is actually a sociology professor. So he was working in Zimbabwe in the late 1970s, and he was teaching art to students. So we all know that Africa being a very poor country, and they don't have enough resources for art. So he used to teach art to children using whatever was available. So it was mud, earth, dried leaves and flowers. That is what he used to teach them art. And slowly it grew to using old paper, and they use like rice is a staple food for us. They use maize, which is their staple food. They call it sadza. The cooked maize is called sadza. So the leftover was used for sticking the paper, and they used to make small toys and learning tools. Slowly it built into making small furniture on which the children could sit for their classroom. For their classroom, they made their furniture. That is how it began. So this is the gentleman, the person who is standing in the middle. So and two people on either side, and they are standing on their APT stool. So can you imagine, this stool is made of card and paper, and it can take the weight of 3 people, right? So that is the strength of the paper furniture. So it is Jean and Kenneth Westmacott, because of which the technique spread to other countries. So Jean and Kenneth Westmacott, they had learned it from Bevel Packer, and then they went back to UK because they are basically from London, and they started spreading it to many countries. So they were doing workshops. They do 1 full week workshops or 2 week workshops. That is the way they are doing it. And it also, they are the ones who have spread it to other areas. Like the Cerebral Palsy Africa, they are associated with Jean and Kenneth Westmacott. So Paper Furniture Social Enterprise, this is the name of the enterprise which is run by Jean and Kenneth. So they are always in need for resources. There are they do a lot of things for donations and all those stuff. And Bevel Packer, he started moving out of Zimbabwe. He used to go to Zambia and Lusaka, and he used to train a lot of people in the concept of APT. So those people developed this actors, right? So this is based in Lusaka. So they are also, all these people are working more towards adaptive furniture for children with cerebral palsy. Because if you see their site or if you move, go into that, see more of children who are more severely involved. The GMFCS level 4 and 5 children who without any therapy, they are missing school, they are lying on their backs all day. So these children are given a standing frame so that they can stand, they are given a seat, they are given an adaptive chair with a cutout table so that they can sit, so that they can be educated. So that is the idea of the cerebral palsy African actors. So the concept of APT is more towards giving children more upright position, more functional position, so that they can function, they can learn, they can be as independent as is possible. So Adaptive Design Association is based in New York. So they are the people who have made it much more, what to say, in terms of technology, they have made it more advanced. So instead of sticking to the original traditional practice, they have made it like quickly designing things and folding techniques and quicker gluing so that it doesn't take longer time. So making things at a lesser time and more contemporary patterns they are making. So you can see how these are mostly meant for low resource settings. Most of the times, like CRP Bangladesh has done a lot of adaptive equipment for children. This is special education professionals of Kenya. So they have trained the carpenters, the regular carpenters. They have trained the regular carpenters on the APTs so that at a low cost they can use, instead of using plywood, wood, or aluminum, or steel for making the furniture. They are trained to do the APTA furniture, that is making furniture with card. So it is more appropriately, you can say it is like cardboard furniture because it is more like carpentry. So it is cardboard carpentry also, right? So we don't need to think that APT was not there in India. So as early as in the early 1990s, I have seen in many of the newspaper articles about Vidyasagar, the special school in Chennai, they have used APT as a form of vocational training for their young adults. So there were columns in the Hindu which talked about the furniture, which are like regular sofas and coffee tables, which were made by the young adults of Vidyasagar Special School. So they probably took the training from Jean Westmacott or whomever. I have no idea. And in Mumbai, this is Mr. Anand Bhave. So he has been doing this as a form of adult recreational activity, and he is associated with NAB, National Association for Blind, and he regularly makes furniture, adaptive furniture for children with multiple disabilities who are referred from NAB. So it has been there for several years. Recently, I was just browsing through the net and I could find that Satya is a special school in Pondicherry. So in 1919, just last year, Diane Lyle, she is a pediatric therapist. So she has been in the Cerebral Palsy Africa. She has been trained and she has done workshops for these special schools for the therapists and all. Right, so this is maybe it has been there and maybe a little bit forgotten, again reviving. So now people are looking for more what to say, eco-friendly models and more sustainable practices. So if you look at it that way, the paper furniture is more sustainable model. So it is really a good thing to do. This person, Harish Mehta, he is in Mumbai, and we have a place, a company called the Shapers and Packers, and they make commercial cardboard-based furniture. So in one of the cerebral palsy day event, so he had made aisles and ramps and a lot of furniture, which he uses paper folding like origami. They use the packaging cardboard is folded and made into beautiful furniture. They are amazing furniture. Maybe you can, if you are interested, you can have a look into their website, and you can understand more about their work as well. Okay, so now let us come back to the APT. So there are four basic rules in APT. One is the articles which we make has to be strong. It should be useful, they should be attractive, and it should be made from materials that just simply cost nothing. So that is very important. So if you see, I am standing here on a very tiny stool. So there is a slogan in APT, small is strong. We don't make any article bigger than what is required, so that the strength can be maintained, right? Because this is not wood, so when they are wet, they are not strong. So the articles need to dry for it to gain strength. So we make articles which are only of the required size, right? It has to be useful. See, for in therapy, we require a lot of equipments. It can be a therapy bench or a small stool. It can be a feeding seat, or it can be a balance board. All these are useful. So nothing is a useless thing, which it's not a cosmetic item or just a piece of art. It is a useful furniture, and they all look attractive because of the way they are decorated, and they are made from materials that cost nothing. So you can see this bench. This is the same bench in which three people are sitting. These are my two children. Now they are grown up, but back then they were small. So this bench, you can see the top of the bench is made only of file cards. So what we throw away, what we give it off to the paper wala. So it is made of file cards. So what I mean to say is it just costs nothing to make the articles. And if you can see, there are small threads. So these are the plastic threads. So you can use that to sew it. So we will see about all these later. Okay, so that is the basic of APT, and what kind of paper you use for APT. Literally any paper can be used. Anything you say, I don't want this, we want to discard it. It can be children's old used pages of the notebook, or it can be newspaper, calendar sheet. We have a lot of brochures now. It is not required now, or invitation cards which are not used anymore. So all these things can be made into useful furniture. We can use thin and strong paper, like newspaper is a weak paper, but brown paper, the one which are used for putting things in the paper bags, they are thin but they are very strong. So those papers are very much used for making the joints around. And we can even use pieces of thin cards, like the brochures, invitation cards, even our sometimes visiting cards. We have changed the clinic, changed the address. We have a lot of visiting cards available. So we don't need to throw them away. It can be converted into useful articles, right? But the one which we use for making furniture are usually the thick corrugated card from carton boxes. So the carton boxes like TV box or refrigerator box, the big ones, the thick ones. The thicker ones, they are used for making more stronger furniture. If you want to make a bigger furniture, more sturdy one, suitable for adults to sit on, then you need to have thicker cards. So if it is just for children, the thinner ones will also do. Okay, so a little bit of understanding about the nature of paper and how it is going to be used. So there is something called the line of grain, right? So if you pick up any page and just put it in front, so there is the lengthwise, sheet. So usually the grains are, along the length. So it is arranged lengthwise, and there is also the short grains, which is like arranged breadthwise, right, along that this way. So in a carton box, it is very easy to figure out, because these undulations, these are also called the flute. When it comes to packaging, that is the word they use. They
Ma'am,
use
extremely sorry, ma'am. Sorry for interruption. The layout has changed. Somebody has presented it, like you have to go out and represent it again. Extremely sorry.
So I have to leave
Leave the session. Go to the session. Present it again. Leave the presentation alone outside.
Okay, fine.
Yeah. Members are requested not to present interrupt in between. Please, the layout is changing. We can't record it. Please understand.
Can you hear?
No, ma'am, I'm not able to see your presentation now.
Okay, so I have to share again.
Yeah.
Is this the slide from where we missed?
Yes, ma'am. Long grains and short grains, same slide, ma'am.
Okay, right. Okay. Right, so in the carton box, usually these are called the flutes, right? So if you keep them lengthwise, that represents the long grain. If you keep the flutes running breadthwise, then that is the short grain. So why we want to know about this? Along the length of the grain, like if I keep the flutes vertical, like this, the lines of the corrugation vertical, so that is the line of strength. That is the line where it has maximum load bearing capacity. But if I keep them across along the short grains, that will not be able to take the load, right? So this we have to keep in mind because, see, for example, if I have to construct a study desk like this, so this is made of paper and cardboard and cartons. So the top portion is like a box, right? So the sides, the corrugation boards, I have to use them lengthwise. The long grain should be like that because that is going to take the load. So we don't want it to collapse with the pressure. The child may put pressure by leaning. This girl may lean on the table. So it should not collapse. So we always have to remember that the grain has to be lengthwise. Okay. The same when it comes to the legs of the table also. So it is a weight bearing thing. So it has to be arranged lengthwise. It is similar to our long bones, how our bones are arranged in sheets like that. So the same way, the grains of the paper also have this line of grain which we need to take into consideration, right? But what about the top board? Because it is like this, so the weight bearing is going to be here. So how do we take care of this? Here we are going to have alternating layers of long grain and short grain, opposite. Right, so we have a crisscross pattern so that it will have more strength when we are loading from the top, right? It is not along the line of the long grain. It is not along the line of the short grain. So we have to make it crisscross so that there is loading which can happen right over it. Okay, right. So this is how we can test for the grain direction. It is fairly easy when it comes to a cardboard, but when it comes to paper, we have to test it by tearing it. So there is a tearing test. You can do a paper fold test. So these are all tests which can easily be done. See, for example, you take any paper. So usually our books also, if you see, they have this, the length of the book is usually the line of the long grains. So when we tear along the long grain, that is the direction in which it will tear more easily. If you tear along the short grain, it usually, goes haywire. So that is how you can figure out the long grain. So when you are going to pick up the paper, you have to test. So, and according to the work you are going to do, you are going to use the paper in the particular direction. If you want it to be on the leg of the chair or the stool, then we want the lines running lengthwise. If you want it to be on the, it should be the top of the table, it is going to go crisscross. One layer will go lengthwise, one will go breadthwise, right? Another way to find out the long grain and the short grain is also when you wet the paper. You don't want to do this naturally, but here I want to tell you one important concept. This is called warping. WARPING. So sorry, I couldn't put it here. So warping is the way things can get deformed. So we are all familiar. If you keep something, the paper gets drenched and then you dry it, it loses its shape. It is not having that neat, flat shape. It will sort of deform. That is what is called warping. And the way things with the paper, especially paper, will warp, we are very familiar with seeing that with wood as well, right? So wood is also nothing but made from the same tree. So paper also comes from the same tree. So it's basically the same material. So the way wood behaves when it is, it is soaked in water, how, it can get deformed. So the similar way, the paper, when it is soaked and then when it is drying, it is going to change the shape, right? So this is very, very, very important when we are making cardboard based furniture, because our furniture is totally damp when they are being made. They are very loose. You can, rip them apart. They gain strength with drying. So the direction of the grains, the way things are dried, is very, very important in deciding how the furniture is going to turn out. So while drying, see, you can see along the long grain, it will shrink, right? So it is going to shrink along the grain. So along the long grain, it is going to shrink like this, right? So this will add to the strength. It will hold it nicely in place, right? So if you are going to paste the cardboards one over the other, so after they are dried, when they shrink, they really become firm. So they become as strong as wood. They remain soft, they may retain the texture of the cardboard, but they are as strong, their load bearing capacity is as strong as wood. So this is something which is very important. Warping is something we need to be aware of. So that is why we test for the grain direction. Okay. So what kind of adaptive equipment we are going to make usually is, maybe we may use standing frames, or maybe a corner seat kind of a thing with the attached frame, maybe therapy equipments like balance frames. So these are all things which we may be requiring. Okay. So of all the techniques, even APT has multiple techniques. There are different techniques for using the APT. The simplest technique which any beginner can use, this is where I also started. See, many of the things which you see here, this one, this table, they were all done 15 years, 16 years back. So at that time when I was not able to do many things, I was also trying. So this layering is the simplest method. So what is layering? You simply take cardboard boxes. For example, if you want to, this is very easy for you to see. This is, you can see that it is probably TV carton. So the inside things have been removed, cut, and then maybe reinforced with extra cardboard. So this is another box. Maybe it was a CPU ka box, or maybe mixer grinder box. So that was kept underneath to reinforce, and everything is layered. What is layering? Layering is nothing but sticking small pieces of paper, repeatedly over and over to gain strength. So this we may be familiar because we have done this as a form of art in our schools. Like we are told to get small sari boxes and then we layer and then make trays or boxes or jewelry boxes. So this is the simplest technique in ATP. This is also sufficient for making simple basic furniture. Like a simple furniture like this. This is a box. So the top has been retained, the bottom portion part of it is removed, and I have put another box, and in between there is a post which has been kept and a small tray. So this is done using layering technique. Here again, one bigger box, and the seat is a smaller box. They are held together by layering of paper, right? So this is also, you can make out that this is a box, but this is just sufficient for a young child who wants to explore, right? So we don't need to make wooden furniture which can cost 10,000, 12,000, 15,000, not needed. This is again a therapy bench made from, the all the three things are boxes. Underneath they are supported with separate boxes, right? And this one is another box which has been cut to the required size. All the corners are intact. You just keep pasting more and more paper to make it strong. So why is that APT is more suitable? See, you can see this. She's a mother. She has, when I told her about how it can be made very simply, she tried it on her own for her young child who is just 4 or 5 years old, who is GMFCS level 5. She can't even hold her head and she can't sit unsupported. So with a rough framework, you can see that it is still not well made. It is not very thick, but you can roughly make something which is appropriate for your child. So there are no hard and fast rules. It has to be made like this, like that, nothing like that. So you are able to give something which is functionally useful for your child. That is great, right? So this is a feeding chair. So once I attended a workshop on for feeding, oromotor and feeding difficulties in children. There I saw a very beautifully designed feeding chair which was made in wood. So when I came back, I wanted to make something for my child who does not have head control, where the mother is struggling to feed the child in a good position. So I could quickly use a box, and then I could just put 2 or 3 cardboards. I could put them together. Not a very strong one, not for an adult to sit on, but just sufficient for a 1 or 2 year old child to sit. So I could complete it in a day or two. And this is just I want. Sometimes as therapists, we find it really frustrating to keep explaining to the carpenter or a person who is making those devices, see, I want like this, little head support here, little trunk support here, this much lean of the backrest. Here you are the person who is deciding, because you know what your child needs. Your parent knows what the child needs. So you are the best person to decide a rough furniture piece, which is definitely useful. If it is really working, you can make a really sturdy one, or you can make it with wood, whatever is the choice. But you can make something which you can try with your child. How many times we have felt that I don't know whether this will work. How can I tell my parents to, shell out 10,000 when I'm not too sure whether the child is going to use it? And several times we have seen that we have made big equipments just to feel them, see that they are just lying in one corner. They are drying their clothes. Sometimes you see families, they have made nice CP chairs. I have seen them personally. What a waste of money. Ultimately, they are drying clothes. They have put their towels there, everything, because the child is not using it. Something is wrong, or one screw went off and they are not able to use it, right? It is really sad. So with APT, at least you are not losing money, right? And furniture can be repaired at home. You don't need to call a carpenter to do it. So it just needs maida and paper. That's it. Okay. So coming to the tools are all very simple. Okay, so we are going to use mainly card, paper, newspaper, all the things which are locally available, which is available in every household. Maybe jute, or nylon strings, just a rag cloth, a kitchen knife, or a cutter, the cardboard cutter. These are all the things which we are going to use, and we are going to use just maida. Maida is the paste which we are going to use. So we are all familiar with using maida paste, maybe for making our kites, or when we used to stick our old notebooks. So this was a glue which we used, but now Fevicol is there. But the paste which is traditionally used for APT is only maida, right? So the advantage is it is absolutely low cost, and it sticks all paper absolutely fine. So it is the best thing to be used. But if you want your work to get dried faster, now you can even use Fevicol. But Fevicol doesn't make it low cost. The cost will increase. Recently, when I did one workshop in Rajkot, the parents were very enterprising. They told me, Madam, why you are using Fevicol? You should use corrugation gum. That is very cheap. So corrugation gum is something which I also learned only recently. So that can be a, it's a commercial glue, but it is very low cost. So that can be used instead of maida if you want to, use it for, regularly. Okay, so there are three stages in making of furniture. How you can make a furniture. The first stage is obviously the preparation, right? So and then you have to build the article, you have to make it strong, and then the last thing is going to be decorating or finishing the article, right? So in the preparation, first you have to have the design in hand. So you need to know what is it that you want. The most needed equipment is what you are going to make. So just because I know APT, I cannot, burden the family with 4 or 5 equipments. And where will they sleep? They may not have space. In a place like Mumbai, place is also a constraint. So I have to look at all those things as well. So what is the need of the child? Where the child is going to use it? Whether we need it for standing, sitting, or is it in school? So you need to plan that out. And what the parents' concern is. So if you carefully listen to what the parents say, then we get lot of inputs. So in the therapy time, we may see that the child is holding the head, but the parents will point out very clearly that yes, for 2 minutes when you are engaging the child is keeping the head straight. But when she is on her own, she may just move to one side. The child does not have adequate control. So these are things which are important for us when we are designing the furniture because we want to have good position. We don't want the parent sitting by the side of the side all the time correcting the position, right? And as a therapist, obviously your input is very, 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 very valuable, right? So once you have the design, clear cut and chalked out clearly, we need to take the measurements. So measurement is like taking measurement for any piece of furniture. So you want to know the height of the seat, you want to know what height it is from the floor, and where the armrest should come, or what will be the width of the shoulder, whether you need some support for the head. The typical measurement which we normally need, the same thing we are going to take. Right. When we are taking the measurement, you have to seat the child properly because many of the children, especially with cerebral palsy, they may lean behind. So you need to position the baby correctly like this so that you get the back as straight as is possible so that you can take a reliable measurement. So instead of using a measuring tape, with a child seated, it is little difficult to use a measuring tape to calculate the length. So it is much more easier if you just use cardboard. So as you are making the furniture or you are planning to, you can use one piece of cardboard and you can use that. Child is sitting, you can just put the cardboard behind the child and then see what should be the level of the height of the for the head, for the shoulder level. Everything you can simply mark it and later you can take a tape and measure it. So here there is a small mistake. So we won't want the child to be seated on a chair. The child's feet should, means the feet should be on the floor. So here the child's feet are dangling. Only then you can take an accurate measurement between the floor and the seat car level. So preparation of the cardboards is important. So when you are going to procure the cartons, maybe from the paper wala. So it may be having all these stickers and the packing materials. So you have to remove them because they will not stick to the maida well. So it is the cardboard the paper will stick well. And there will be pins. So all these things to be carefully removed. And you need to open up all the boards and you will look for the grains and then you are going to arrange the cardboards, right? So you want everything nicely spread out and according to the thickness, if it is for the seat, if it is for heavy furniture, you would obviously want more thicker cardboards to be used. Okay, so making the furniture or for that you have to, like how we make a furniture, you will need plywood, right? Exactly the same way we are going to make plywood, but this plywood is made, we call it simply boards. These are made by sticking several pieces of the cartons together. So we are going to stick them together so that it can make a board, right? So as we discussed, so we have to consider the line of the grain and accordingly we will use. So if it is for a weight bearing surface, all the grains are running lengthwise. So depending on the thickness of the cardboard, we may use 5 layers, 6 layers, 8 layers like that. If it is for the seat, the grains are crisscross, right? So we have to apply a layer of maida and then stick one layer, then again maida, then put the other piece of cardboard like that. You have to do this really quick, otherwise the maida will dry. Once if you put everything, we do a rough binding. So the edges, see now all the cardboards have been put one over the other. Then you take small pieces of paper, apply maida and do a rough binding so that the edges won't open up. Otherwise they will warp, they will open up like that and then the board will not be strong. It needs to be stuck with pressure. This is another APT slogan, paste plus pressure is equal to stick. So, this pressure, here the therapist is using a balance board, it has been inverted and you can stand on it for a while or you can put some heavy weight, maybe sandbags, or if it is a table, you can simply invert a table. And pressing the boards to dry is usually fun. And it is ideally a group activity. So if you are in a cerebral palsy unit or it's a special school, or you can have gather your parents together, because it's little tedious to do things alone, right? Because it is more like carpentry. So it is little strenuous. It can be a good muscle building activity as well, but it is little strenuous. So it is fun to do it as a group. Okay, so we will obviously, apart from the boards, we will also need the tubes, which are like the rods. So we can make the tubes either by using card or with paper. So the best way to do it is you apply the paste on the paper, again taking into consideration the line of the grain. If it is going to be the leg of a stool, all the papers will be stuck in the lengthwise of the grain. If it is going to be a support, it is going to go under the seat to support with the weight bearing of the seat, then it is again going to be crisscross pattern. So you can use any cylindrical thing like a broomstick or a mop stick or anything, or a PVC pipe will also do. And you are going to apply paste liberally and then roll it. Roll it as many layers you want as you can roll it, make it tight, and when it is still damp, quickly remove it and leave it to dry. Right? So this is how it will be made. Okay, so now the parts are ready, like you have the boards. If I want to make a chair, so I have made all the boards ready and the tube which is required, that is also ready. We have to remember that drying is a very, very, very important thing, because we all know the cardboard will warp, it is going to bend and deform. So if you want, the first step towards making sturdy and well aligned objects is to observe when they are drying. So you leave them under the table for it to dry. After 2 hours, you will remove it. You keep it vertical for a while so that it will get some air. Again, after 3-4 hours, you are going to put it under the table and with pressure it is going to dry. So drying can take time depending on the climate. And preferably, we are not going to do any of the paper furniture when it is monsoon, because then things don't dry, it will remain moist and it will catch fungus, right? So we will not do them when it is monsoon, but even in a dry climate, it takes time because it has to dry within all the layers. So it can take maybe 2 days or one day, 3 days, depends. It can vary, right? So once the parts are made, we have to join them together. So joining the tubes, you can usually it is by tie. You can tie it with, you can see these are jute threads. So sometimes you can use the thread to tie, and then you can cover it with paper, and then the thread can be removed. But sometimes we may just leave the thread there and just keep layering the paper on top so that the thread remains inside. It is not removed at all. So this is how the tube is joined to the tubes. So to join the tube to the board, like for the leg of the stool to be joined to the top of the stool, so that one end of the tube is cut lengthwise. It is made like a flower, and then you apply paste and you are going to stick it to the board like that. And then it is going to be reinforced with lot of paper strips, like pasting, layering, that is using paper to stick everything. So this is a balanced board. So it is very strong and the things are little heavy as well. So here we have stitched it. So you can use thin nylon threads to stitch the top board to the side curved board. So you can simply stitch it, right? And as we are doing it, we are going to keep the joints in position by using lot of layering. So when they are wet, they can all fall apart. So to prevent that, we are going to tie them together. Like when they are making a chair, see how it is tied here, 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 so that all the parts are held together. So we have to keep them tied together in the drying process. And we have to keep observing in the drying process so that they are any changes can be made. All the changes can be made. So this is a small stool. So two boards are joined by slots. So there are two slots made in these two boards and then they are fitted together and then the top board is joined. So this makes a simple stool. So to join it, you are going to invert it and we are going to join it using card and paper. If you use small card pieces, it is also much better so that it will become very strong. And as we are doing this, so it has to be put under pressure. So there is a weight which is put on top of these tools so that the joint is not loose. Okay. So before you proceed to making the article further, before you start layering or finishing it, building it further, you have to check whether the article is according to the requirement. So you can see after it is stitched, so no paper is put in that, so it has been stitched to the underlying things. So they are checking. You can have a look again. So it is able to take the weight of an adult, right? So it is very strong, very sturdy, and it is quite long lasting as well. So this will give you some idea about the strength of the articles which are made. Okay. So in every stage, it requires drying. So you can see it is tied so that the legs will not splay out, right? And the first layering is done with card so that to make the joints very strong, right? So the drying process is very, very important. So once the one layering is dried, you have checked that everything is in position, then you want to strengthen and tidy it. Strengthening is usually with layering. So if you are going to use, for example, you are going to use magazine sheets, like the regular magazine sheets. So you can you can apply paste, stick one over the other, 3 or 5 sheets, and then you can cut them into thin strips. And here another important thing is we never use scissors. All cutting, everything is only tearing. So there is something interesting which I want to tell you. See, when you are going to tear, if I'm using card, this is a card. So if I'm going to tear like this, there are this feathering of edges. This will take the glue nicely. The surface area increases, so the sticking will be better. So many people may think that, I will do a very nice and neat job. I will cut with the scissors. But then that will not increase the surface area. These feathered ends are very important, right? So that will help your work to be stuck much more strongly. So we will only tear, right? So we can use these things can also be made thinner and they are used like straps. They can be used like a rope when you want to take it around a joint so that it will be made strong. So the same paper can be used, right? So depending on the strength of the paper, you are going to use it. If it is on the surface, you can use newspaper also, that is just sufficient. But if you are going to put it on the joint where you need it to be really strong, you want to use stronger paper. That is the time you will probably use thicker paper. So how you will know whether it is the paper is strong or not strong? By pulling it. If you see newspaper, when you pull it, it quickly, you can just pull it and it comes off in pieces. But if it is a thicker paper, you try to pull it, it doesn't take off. tear so easily. That is the strength of the paper. So you will use stronger paper where there are joints. Where it is plain surface, you just want to strengthen the the surface of the cardboard, then you can use thinner paper as well. So the final thing is the decoration. So obviously everything being low cost, we are not going to use expensive things to decorate it as well. So the choice usually is to use magazine papers or calendar sheets, colorful pictures, whatever is thrown away. Whatever we don't want, whatever we put to the paper wala, those are the things which we are going to use for decorating. Sometimes some children like, especially boys may like cars or Ben 10. These are all pictures, additional pictures you may want to stick. But in traditional APT, they use earth colors like they may use mud, finely sieved mud. Like red soil can be sieved to get that earth color to your furniture. It is mixed with the maida paste and it is smeared all over, right? They may even use ash or they may use soot, but now we cannot find those things, right? So we may have to use either colors, it is usually water-based colors, or it can be simply paper, right? So here also you can see all these things are decorated with simple paper. And the final finishing. So when you are thinking of the decoration, when you want to come to decoration, your article should be completely dry. It may appear dry from the outside, but it will be moist within. So how you can figure out if your article is dry thoroughly is by checking the weight. I don't mean to say you should use a weighing scale. If you pick up the article, so if it is damp, you will see that it is heavier. With each passing day, you will see that the article starts becoming less and less heavy. It becomes lighter. That means it has left the moisture, right? So it feels like you're lifting a carton box or a slightly heavier carton box. So that is the right time to do your decoration. Don't be in haste to complete the decoration because if it remains damp inside, then it is going to have fungus or it made the dampness. With the dampness, you are making a child sit on it, then the parts will become loose and then you will feel that, oh, the articles are not strong enough. So it has to be dried thoroughly for it to have that strength, right? So that is very important. Okay. Once everything is dried, you have completed the finishing. That is also dried because here again we are sticking. Then to complete the work, you can use varnish. So varnish is rather low cost, so you can paint it with varnish so that it can be protected from pests and dampness, right? So there are few things which may be added things. Like for example, this is a balance board. So if you are thinking that this black thing is color, no, this is not color. So this is the inner tube of cycle, the cycle inner tube. That is what is used here. So we all know that the balance board can be used by adults as well, and it is going to take a lot of stress. So imagine what will happen if the cardboard is getting pressed continuously and it is going to be moved. There is a lot of shear. So the edges of the cardboard may wear away. So to keep it intact, a cycle tube has been slit and it has been made like a shoe and it can be stitched or it can be stuck to it using Fevicol or any commercial glue. The glue which is used by cobblers for sticking the shoes and all, that can be used. The rubber-based synthetic glue, that can be used. Whatever you want to use. It can be stitched also. This particular thing was stitched. This was done by the special educators of NIMH. So they wanted to stitch it. So this was stitched. So this gives longevity to the article. So being a rubber, it will prevent from slipping. So it gives a good grip, and it will also prevent wear and tear of the edge, right? So this is how the finished articles can look like, quite colorful. And here you can see in this balance board, this I made, I used the old suitcase cover. In olden days, we used to have this VIP suitcase and the nice cover on that. So this is the cover which you can use fabric. Fabric can be stuck over it. So it gives a good texture, it can be made colorful. Here again you can see some of the toys like stacking blocks and all they have made. So they have used fabric to cover it. It is not advisable to use these kind of gift wrap papers or any paper, the plain paper here. So this kind of paper will tear away, right? Anyone has the intention to slowly rip things apart and everything will come out. So it has to be small pieces of paper which are stuck together and nicely covered with paste. Okay, there are few points which we need to remember. One thing is we need to not do it in monsoon time because the furniture won't dry at all. So, or if you are in a place where it is much more dry, the climate is usually dry. So that is the place where we can best make use of this furniture. In places like Kerala, somewhere where it is going to be raining, most times of the year, it may not be the ideal choice, right? And small spills can all be easily wiped clean, right? But if you cannot use it in bathrooms, you cannot keep it in an absolutely damp area all the time, right? So, and you have to finish and you have to dry your things, but remember that we should not dry it under the sun. Why? Because when you put things under the sun, there is going to be uneven drying. So this will result in warping. So they need a dry climate, but it has to be dry maybe in open, maybe at the balcony or in an open terrace. You can put it to dry, but not under direct sunlight, right? So there is a small video. Uh,
Ma'am,
Amal,
yeah,
it
yes,
is,
ma'am. Yes, ma'am. We'll play from our side, ma'am. We'll play.
yes, yes,
Senior
please.
physiotherapist at Mashada Cerebral. Hello, I'm Dr. Nandini Nandani, Senior Physiotherapist at Mashada Cerebral Palsy Rehabilitation Center, Ramakrishna Ashram, Rajkot. I have been working there since last 4 years, and today I want to share something about appropriate paper-based technology. So first, let me brief you about what is appropriate paper-based technology. Now, it is a technique wherein using cardboard and paper we can create various articles used in therapy like wedge, bolster, standing frame, and many more. So, what is the history of appropriate paper-based technology? Mr. Bevel Pecker and his wife have been working for years in Zimbabwe, experimenting and developing various techniques used to create paper furniture, and then they called it appropriate paper-based technology. One of the potential advantage of this is that we can create ample of articles which are strong as well as durable using waste items like cardboard and paper instead of wood and metal. So this will be cost effective as well as there will be very less harm to the environment. So, we were lucky enough to attend such workshop under Dr. Nigamaja Hariharan. Under the guidance of Dr. Dhruv Mehta, who is also an advisor of Mashada Cerebral Palsy Center, we organized a workshop in September 2018. You might be surprised to know that this workshop was not only meant for staff but also for parents. Total 25 staff members and parents of 30 children participated in this workshop. We were provided guidelines by Dr. Nigmaja about what preparations are to be done. Furthermore, during the workshop, she taught us principles of APBT as well as gave us practical demonstrations on how to make furniture. The participants were divided into various groups and made different items like corner chair, feeding chair, wedge, bolster, standing frame, therapeutic bench, balance board, and walker. We did not limit this to the workshop, but we continued it further as well. After the completion of workshop, we conduct parents meeting every month and guide them on how to make paper furniture. With this initiative, many parents are benefited and they have made articles for their child. In addition to this, few parents have also started making furniture commercially and selling it. Also, we are now thinking to incorporate this into tele-rehab and provide guidance virtually. We are thankful to Dr. Dhruv Mehta for initiating this, and we are grateful to Dr. Nigamaja Hariharan for sharing her insights and knowledge over the subject. Indeed, this cost-effective technology is like a boon for our children. Thank you. So,
So these are some of the useful links. So in case anyone is interested to look into how these furniture look like, and for more information, we can also see these sites. So now we can take questions.
Am I audible? This is Annie.
Yes, ma'am.
Yeah, good evening, everybody. I'm glad I was able to get through today. I've been trying all the other sessions, but I think it's my lack of doing something. I don't know what. But anyway, I think you did a good job in the presentation, Nigamaja, because it is a very demonstrative uh, session, really. And you were able to talk about it. And I
Thank you,
think that's
ma'am.
a good job that you were able to talk about it so well, because I'm quite familiar with it because I was working at the Spastic Society of Tamil Nadu, Spaston.
Oh, that's
Right
really
now
nice,
I'm in
ma'am.
Kerala,
Okay.
and
You can
in the
add, ma'am. You can.
1990s,
Okay.
in the 1990s, we had someone from one of the African countries. It's a bit far long back that I can't remember.
Okay.
Maybe from Kenya or Zimbabwe, I'm not sure. Somebody
Okay.
did come, somebody who was trained by Bevel
Okay.
Packer had come and he had taught the staff, and we
Okay.
had an entire team that was doing the AP appropriate paper technology unit,
Okay.
and it's really a marvelous thing. I don't know why it's not much more prevalent than it is now. It should be a lot more because in rural areas, which India is almost 70, 65 to 70% rural, and I think this particular paper technology should be transported to all of these areas where parents, persons with disabilities, as well as other people who are not disabled too, should be able to learn to make these equipment. As you said, the drying, I remember very clearly. I mean, I've left Spaston almost, over 10 years now,
Okay.
11 years, I think, since I've retired. I remember very clearly about the drying. You mentioned it, and I think that's a very good point, because if it doesn't dry, no matter how beautiful your equipment is, if it doesn't dry properly, and in places where the humidity is high, and as you said, rainy places, especially Kerala, and at this point in time, I don't think we can even think about it because of the monsoons.
Exactly.
But it's a very, very important technology that has been under, what shall I say, exposed. Not
Exactly.
enough exposure on it.
Exactly. The main reason
We
I
need to
feel
have
that
more of it.
the main reason is
Sorry?
because it takes a lot of time. To make one furniture, it may take a week or 2 weeks.
Yes,
So no one
yes,
has the
yes,
patience to do it. So that is why if you see the
yes,
site about Adaptive Design Association, so they make it really quick.
yeah,
They use commercial glue and then they don't use many layers. So they use the folding methods also. So which makes
yes,
quicker, things. So the APT is also evolving. So the traditional method was to make boards and drying and then pasting and drying and pasting. It takes a lot of time. So there is a lot of scope for innovation. So you can put together the simple
yes,
layering method
that's
can
true,
also be
that's
used.
true.
So we should just put our hands together and start working on it. Figure out how we can make it work within the existing settings. So, that is the way to make it more user friendly. The thought that it is going to take 2 weeks and your house is going to be messy will
Yeah,
put off everyone. So, no, then nobody wants to take it up. So, and it's good to do in a group. So probably special schools can do it in the schools during vacations. Summer vacations could be a good time to do it. Thank you, ma'am. Thank you for
Yes,
sharing your insights. It
yes.
was very valuable.
The point that I would try to really make is that for many people it is just a theory, and it would be nice if more, even our the College of Physiotherapy, if there is some little area where this can be done, I think it
Yeah.
would be really useful because a lot of this in the CBR program, the rural areas, parents would really benefit by this. It's not only for equipment for the children, toys for the children can be made.
Yes,
Um, you
absolutely.
can also, any furniture for the child, for yourself, teaching learning materials for your special educators.
Yes.
I think it is a really, I'm just trying to emphasize the importance of this, where this should be used even more. Anyway, I don't want to hold for too long. Thank you again. I think that is a refresher.
Thank you, ma'am.
And I
Thank
hope
you
more
so much.
people will take it up and take it forward.
Yes. Ma'am, here there is one thing I would, just like a small suggestion. This is something which I also use because when we say that you can make something with card, you can make something with paper, nobody is willing to believe, right? So for many of us also, if it is a new concept, we will not trust anything which is made from card or paper. So what I generally do is if I have some article which is made, like a adaptive chair or a therapy bench, anything, one article I like to keep in my own clinic. So when I also use it for the children. So I let the parents see that, something which is made of card or paper is working well in a clinic for so many years, then they are more likely to believe it, trust, and they believe that they can also make it. And that can be a good beginning for pediatric
Yes,
therapists who are
yes,
trying to, share the concept with the parents. So that makes it little easier.
yes,
So they get an idea.
yes, definitely, definitely. Yeah. And it can become a livelihood opportunity for various people, who would like to do this. But the training should be a proper training. So those sort of things should be looked into,
Yes.
where train trainers who can train other people to make this. Like you said, it's not just having paper and cardboard and people really not people wondering how it's going to look at the end of it.
Yeah,
So, um, yeah. So I think this is something that we should need to promote a bit more as well.
definitely.
Anything else? No. I think it's a good topic, and I think it's something that we should take forward to.
Thank you, ma'am.
Ma'am, that was an innovative and a thought-provoking session, ma'am. Ma'am, like my thing is like most of these furnitures are being used in pediatrics therapy,
Yes,
isn't it, ma'am?
yes, yes,
Like, has it been tried in adult rehab or something like that?
yes, definitely. See, the traditional APT, they have used it as a, seat which is used for, the spinal cord injury patients because they have a lot of pressure source. So for pressure relief, they have used seats which are made from carton boards. So, now we have different kinds of material which are used as a foam, for seating material. But the cardboard, because it doesn't get heated up so much, and it has a lot of air pockets, and it will not have a lot of pressure. And they can make small holes if there are some areas of pressure points where they can make small holes, and it can be used for spinal cord injury patients. And it can be, in a regular wheelchair if we want to make some adaptation, if you want to make a seat insert. So on a regular wheelchair, you can use it. So it can be used that way also. And we can make seat wedges for all our back pain patients. Many times we tell them to buy seat wedges, you put it on your office chair, you sit so that you can get that perch position and all. So you can tell them to make their own seat wedges, or you can get someone to make it for them, so it can be used that way. And regular commercial furniture can also be made. Now people like environmental friendly products, so it can be regular furniture as well. So they make big sofas also. They make small nesting tables and chairs which are used in nurseries. That can also be used.
Thank you, ma'am. Thank you. Members, the session is open for questions. You can drop a question in the chat box or you can ask your questions.
Ma'am, good evening, ma'am. I have a question for you. Nigamaja, ma'am.
Yes, ma'am.
I'm Selvi, working
Yes.
for Burns and Plastic Surgery, KNC. So
Okay.
first, I want to congratulate you for the wonderful session, ma'am. Very interesting and very informative.
Thank you so
See,
much.
ma'am, we work with patients suffering from burns and all. See, the problem is we had a tie-up with one social organization, and we were dealing. I mean, just to engage the time for the
Mm,
patients and all, no, just to motivate. We used to do a lot of flow mats and a lot of crystals, chain work and all. So of late, I think this can also be taken into account. And
absolutely.
my question is there any idea or ways and means you can disinfect, ma'am? Because any product from a burns patient, you have to be careful about the infection point also. So any other ideas? Any other clues, ma'am?
See that we won't be able to, because when you look at the cartons, so we cannot obviously disinfect the cartons. If you are getting it from your home, you buy a refrigerator or a new television set, you get the cartons. But we cannot say that it will be absolutely germ free.
Okay.
But if they are clean, they clean cartons, or maybe you can spray some, the alcohol-based sanitizer or something. That should be good enough.
Okay. Ma'am,
As
my question is when you
yeah,
take it to the market from a burn patient, the
uh,
product should not be infected from them. So either way,
no,
it should not
no, no,
infect.
no. See, we are going to, when we are finishing the product, we are going to dry it thoroughly.
Okay.
So only if there is some moisture, then the germs can remain there. See, healed burns patient, if the patient is going to make furniture, obviously everything is healed well. So there are no infections.
No, for
So,
in our department, maybe the lower limbs are affected, the upper limbs will be free. So in that case, if they get engaged into doing in some sort of this,
yes, see, they, what they usually do is, if you use the work surface like a large bench, large table, if you use, then you're not going to be sitting on the floor. And for many people, working sitting on the floor may be little cumbersome. So then their lower legs, which may be infected if they are covered, they are not going to come in contact with their work area. And it is much easier ergonomically also. It's much better when you are having a table to work on. So if their hands are not infected, it is no risk for the patients as well. And in fact, it is a good kind of engaging adult recreational activities. In one of the workshops which I did, there was an occupational therapist who was working for mental health center. So he said that I would like to use this for my patients who are recovering from mental health issues, because it can be a useful, socially productive, you know, recreational activity for an
cost
adult.
effective, yes.
Yes, cost effective, and they can earn a livelihood also.
Yes, ma'am. Thank you so much, ma'am. Thank you.
And you can tie up Selby with center with special needs. If,
Yeah.
if, if, the, if they can make good quality product, and if
Mm,
you can find takers for that,
mm.
then it becomes a beautiful symbiotic relationship. It will work
Yes, ma'am.
beautifully for you.
Yes,
So they
true,
can
ma'am.
keep making products, and there are users, and you can be the bridge between them, helping with the designing and
Yes.
other aspects as well.
Definitely, I'll talk about this to our HOD, ma'am. Thank you so much for a wonderful presentation. Thank you,
Thank you,
ma'am.
Selvi. Thank you.
Thank you, Nigamaja. It was
Thank
really very nice. In my student days and during when I was working in GH and all, we used to make cervical collar with newspapers.
Yeah.
See now, only that I remember. Now you have done so much with papers and cardboards and everything. Really a wonderful job. Keep it up. God bless you, ma.
Thank you, ma'am. Thank you.
Members, any other questions?
Excuse me, I am Lily Pushman. No questions, but very crystal clear details you have given. I want to
Thank you, ma'am.
appreciate the special technology in papers.
It's already
Thank you.
developed. Mr. Bevin Packer has developed it, and so many people have adapted and made a lot of changes. So,
So I also used to do being a therapist for us. Devika Rani madam told no like paper collar like that. We used to do for children. That's all.
exactly.
But
Ma'am, actually, they're inbuilt in us as therapists because in our college days, I still remember, we making splints with cardboards and then little bit of cotton and, you know, we have all been doing all these things. So for
yeah.
us, it's just an extension of our, like widening the perspective, like getting understand little bit of the technicalities of how we can effectively use the material which we are already familiar with.
So by experience, we can extend our modification of technology that application
Absolutely,
in paper.
absolutely, ma'am. So we need to have
Yes,
the basics in place. We have the basics in place, so we just for more things which will just add. It will keep on adding at the periphery, so widening our
so
space.
as far as my concern, because I am very interested in handworks making with
Okay,
papers, cards, like that, small things, I'll
okay.
make it idea.
Yes, ma'am. Actually, they use lot of toys. They make lot of toys. They make rocking chairs, all the riding animal toys and all. It can all be made from paper. Maybe once you go through the websites, once you look into that, you will pick up much more ideas. And
Yeah, will
everyone
suit
can come up.
according to the problem, whichever the thing the patient need.
Yes, exactly, exactly. What is
Yeah,
the need? We can make solution. See, from
yeah,
as a therapist, we keep thinking in that direction. It will be nice if there is support. It will be nice if the chair can reach a little bit back. Now we have the means to make it in a low cost way without adding burden to the family. Because if
right.
the same has to be made with wood, we have to think really a lot.
Very good, very good. Thank you.
Thank
Very
you, ma'am.
wonderful presentation. I like it. God bless you.
Thank you, ma'am. Thank you so much.
Nigamaja, have you tried walking stick and walking the crutches?
Crutches I have not tried none. I have tried the walker. So there is in the beginning of the presentation there was one walking frame, so which I have done 15 years back. That was made exclusively with paper. So
Okay.
only with paper we can make a walking frame. Walking frame can be made. See the crutches or the other things they are usually not very expensive. Right? So, many people don't want the crutches. It may cost 300 rupees, 700 rupees. Disco also is not very expensive. So people are able to buy them usually. So they are not as expensive as a sticky chair or a standing frame, which are more expensive. But in using APT, it is possible to make crutches. It is possible to make other, stick and all the other equipments also.
Okay, okay, ma. Thank you.
In case there's no other questions, like, can we wrap up with your permission now?
Yes, ma'am. Yes, Amal Mohan. We can wrap up this session.
Thanks.
Thank you so much, Amal Mohan. Thank you
Thanks a
so
lot,
much
man.
for all my teachers for giving this opportunity to share about this beautiful technique. Thank
Thanks.
you so much.